Good evening, everyone. I'm Dr. Marty Ross, and as you know, this is another Conversations with Marty Ross MD tonight. It's a webinar where we're going to discuss Lyme disease, and I love doing these in the Zoom room now because we actually get to have a conversation too. I'm asking everyone to write your questions to me in the chat box. And the reason I do that is that makes it so that everyone can see those questions, and I will read them out loud as I get to them. And the reason I still read them out loud is in the recorded version, the questions don't show. Okay, so that's why I do read them. I usually don't get to all the questions. If I don't get to your question, doesn't mean I'm purposely trying to avoid you. It just means there's a lot to talk about. And as you all know, if you've been in these webinars or you've heard my recordings. I use a question as a platform to discuss a lot of things. So I hope you get some good information out of that as well, too. So I am creating a recording of tonight's webinar. My plan still is to try to get it out by 9 to 9:30 a.m. tomorrow, but I've got one complication, and that is I'm heading out tomorrow to drive all day from here to Colorado Springs in my camper van to see my dad for a couple of days. So I have to see how I'm going to sandwich that in. If the webinar gets edited in a way that works well tonight, I may even get it all completed tonight and get it out early in the morning. Otherwise, I might not get to it till midday tomorrow. So just bear with me. My intention is still to try to get it out, but I've got life is intervening here just a little bit. So to next week, I am off, and the reason I'm off is I'm giving a talk in the middle of Ohio in a town called Berlin, Ohio, and I just won't be available to give a webinar next Thursday. So we're off next Thursday, so I'll be with you again in 2 weeks then. Okay, all right. So why don't we go ahead and get started here, and let's see what we got here first. So first question is from Chris. Hi, Chris. What's the difference between yeast and candida? Are protocols different for each? Are biofilms involved and need attention? What is your most effective yeast candida killing protocol when leaky gut and H. pylori is present? All right. Um, so when I talk about yeast, I'm actually talking about Candida. I'm talking
Okay.
specifically about Candida albicans. Okay, so when we talk about intestinal yeast overgrowth, that's usually what we mean is a yeast called Candida albicans. It's a good question because there's also healthy yeast that live in the intestine. So for instance, there is a healthy yeast called Saccharomyces boulardii. We call it Sacro B for short, and it's if we use that as a probiotic, for instance, it can be very helpful at preventing C. difficile diarrhea, which is a type of diarrhea you get from a bacteria in your intestines growing too much on antibiotics called C. difficile. Sacro B is one of the a healthy yeast that helps combat that, actually. And it also is something I usually revert to if I've got somebody with diarrhea and I'm trying to manage it with probiotics. Often Sacro B tends to be a more constipating probiotic for whatever reason. Okay, but so to answer your question again, Candida albicans is what we're talking about. So in terms of can they be biofilms? So yes, there can be yeast biofilms, but the one thing about biofilms, and this is not just for Candida yeast, this is for Bartonella, this is for Borrelia. The standard antimicrobials we use to kill Lyme, or the antimicrobials, whether they're herbal or prescription, that we use to kill yeast, also can do some partial eradication of biofilms. So sometimes we don't necessarily need to do things that go in full on and target biofilm. Having said that, the one place I do like to be very aggressive with biofilm management is in Bartonella. Bartonella biofilms just seem to be really something difficult to deal with. But typically in a Candida yeast treatment, unless I've got somebody that is having a lot of difficulty with recurrent Candida, or we're having difficulty getting it under control within a month or two of a decent regimen, then I might start using some support supplements to help break down those biofilms. But generally, you don't have to. And then in terms of what I would call the most effective, so usually where I like to start if I'm looking, so you can treat herbally or with probiotics, or you can do prescriptive antifungals with probiotics. If we look at what's going to have the greatest chance, I usually like starting with a combination of something called fluconazole, which is diflucan. And I like to pair it either with nystatin, which is a prescription, or instead of the nystatin, using a herbal antifungal at the same time. And I like using a product, for instance, that has caprylic acid in it, garlic, and oregano. That's a product called Capri Plus. The ingredients in there do a good job killing. So you could either do like a fluconazole 200 milligrams one time a day, coupled with nystatin 2 pills twice a day, or fluconazole coupled with that oregano, garlic, caprylic acid combination, 2 pills twice a day on that. Typically, with fluconazole as your lead agent, it's you have a 90% chance of getting rid of yeast in about 30 days. It tends to be a very effective treatment. Okay. If you were to go just all herbal by doing that, again, looking at that combination with the caprylic acid, that tends to work about 85% of the times, but it's going to take about 2 months. Okay. All right. Now, to be clear with your question, I just want to raise one thing. If you're asking for the best thing, I can tell you what the best thing is, but I keep it in my back pocket as a fail-safe, and that is the strongest anti-yeast medication that we have is something called amphotericin. And amphotericin, when I was in training, this in the early days of HIV and AIDS, that was the IV medicine we had to use that people had Candida infections in their bloodstreams. Okay. And that's how I learned of it. And when we used it in that situation, in my training, we used to refer to it as amphoterrible B because in an IV form, it actually is quite toxic to your body. Okay. The good thing, though, in an oral form is amphotericin is just not absorbed out of the gut or minimally, barely absorbed. And so we don't have the side effect issues at all. And it's good it's not absorbed because then it just sits there and kills the yeast. So my go-to medicine I use if we're having a lot of failure or somebody's developed resistance to the azoles, fluconazole, itraconazole, I might start looking at amphotericin, which works 95% of the time. Okay, compared to that diflucan I was saying, that's 90% of the time. But Ampho takes about 2 months. It's slower acting. It plods along. So, but I keep that in my back pocket, basically. All right. And then, let's see, taking cholestyramine, I believe you recommended for Ochratoxin A. Could you please break this protocol down completely, specifically when to take during the day? So cholestyramine, in fact, I'm gonna show you all. I think you may be aware, you may have seen the table that I just created this week, but I'm gonna show it to everyone here. So bear with me, everyone. I'm gonna do a screen share here in case you didn't see this. So in my mold article that I have on mold toxin illness, I developed a table. It's right here. It may be a little small for you to see, but basically it takes most of the binders that we use and tells you what they're going to work on. Okay. So cholestyramine is one of the agents that's good for ochratoxin. It also picks up a number of other things, but the big one be mycophenolic acid. It picks up trichocethines, which will be your black mold toxin. So it's a general good binder. I think this table, to be honest with you, I think even though this is what the science says, in working with cholestyramine practically, I think it does a lot more than this, but this is what the science tells us at least. Okay. All right. All right. So and then I'll just point this out. Ochratoxin can also be done with activated charcoal. Just activated charcoal alone is a good agent for that. Bentonite clay, it can do it. So there's a lot of things that work on ochratoxin. It's one of the easier ones to pick up in terms of your binder options. Okay. All right. So in terms of using your binders, whether it's cholestyramine or whether it is a product that has a number of binders in it, like that like would be a combination with activated charcoal and other binders in there. The thing you want to do is make sure you're not taking anything else with your binders because they're called binders for a reason, right? Now, they're going to tend to bind fat soluble things. So, but in general, I just say just don't take anything with them. So the way that I do that is I recommend stopping all medicines and supplements beginning 30 minutes before cholestyramine or whatever binder you're using, and then not taking any medicines or supplements for another 2 hours after you take that binder. Okay. Now, I will tell you, the pharmacists are a little bit more strict on cholestyramine. They're going to tell you 2 hours before through 2 hours after they think you get into some interference with binding up other medications. I just don't see it. I used to do it that way, but I slowly in my practice just pushed it more to half hour before through 2 hours after, basically. Okay. Now, the good thing about food is you can actually do food anytime in there. But an ideal time to have even a small snack of something would be about a half hour after you take your binder. And the reason is the toxins, the way they're getting processed is your immune system doesn't break them down. So they go to the liver, and through the liver can't detoxify them either, but they get excreted from the liver into the bile system in your gallbladder. And if you have a gallbladder, some of them will be stored in the gallbladder. Every time you eat, your gallbladder contracts. All right. So if you wait to have a small amount of food until about 30 minutes after you take your cholestyramine, for instance, or your other binders, what happens is that binder has worked its way into the part of the small intestines where the gallbladder spits out its stuff. All right. So you get a little bit maybe better grabbing action and binding action from doing that. All right. All right. So I think I got that. I think I hit all your parts there. So Chris, did that answer your questions for you there?
It did. Thank you very much. Appreciate it.
Do you have any follow-up questions on that? Or are you okay?
The only quick question, I guess, is I actually already tried the cholestyramine a few times, and it's weird that you feel a Herx. Why would you feel a Herx when something is binding the chemical?
Yeah, so that's a good question. Let me just say what you're having is a cytokine surge, and I'm just bear with me. I don't mean to go too technical here, but
Oh,
I'm
I
going to
get
go
it.
technical. All right. So what a Herxheimer reaction is you kill germs and it triggers the immune system to see dead bug parts, and the immune system makes more cytokines, right? So
Okay.
one type of a cytokine surge is a Herxheimer reaction, which means that germ killing triggered more cytokines to be made. Technically, we don't call a cytokine surge for other reasons a Herxheimer. All right. Herxheimer is just dead bug parts is what triggers it. All right. So I mean, the end result's the same. It's just a cytokine surge, right? So what
Gotcha.
happens when you basically your blood is used to seeing this pool of toxins that keeps recirculating. They go into the intestines, they get reabsorbed again, then they go back into the blood, then through the liver, down to the gallbladder, out into the intestines, get reabsorbed. So, but it's a constant state. All right. Now, when you use a binder and you pull stuff out, you bind it in the intestines, you now have nothing being reabsorbed or a lot less being reabsorbed back in the intestines. That creates a void in the bloodstream. And the way our bodies are designed is we fill those voids. So you start having other toxins move into the blood then. And some of these may be mold toxins, they may be other toxins, but you get a movement of mold into the bloodstream. The immune system sees that and makes more cytokines. So that's where your cytokines come from. So, the simplest way to manage that again is I like using curcumin, liposomal curcumin, 500 milligrams 3 times a day. If that's not enough, you can either double that, you can go up to 1,000 milligrams 3 times a day, or the other thing to consider adding in is liposomal glutathione. Glutathione also can help interfere with those cytokine surges then too. Okay.
Perfect. Thank you.
You're welcome. Anyone else have questions about that? Yeah, Charles.
Real quick question. Where does well call fit on that chart, would you
Well,
say?
call would be it would fit in the cholestyramine category. So
Okay,
well
just
call is kind of a pill form of cholestyramine, but not technically. It's a little bit of a different chemical, but I put them in the same. They work the same way.
same way, a little weaker maybe, or
I would say it's an equivalent. It's equivalent strength to the cholestyramine.
okay, great, thanks.
Yeah, you're welcome. And then Tracy, is that you again, a Zoom user today?
That's me, the Zoom user.
I can tell.
I actually just put this in the chat, but it is related to what I'm interested in on your chart. The spore-based probiotics look like they're doing some heavy lifting.
Yeah.
And I'm wondering if there are particular ones that are
I don't think anyone's really researched, at least in what I read, I didn't see a brand per se, but I think, when we're talking spore, based probiotics, we're talking Bacillus is the main species, right? And the thing about spore forming is they're actually not native to us. They don't regularly live in us. We do get them from soil if our food wasn't cleaned so well, and they would in an environment like in the old days before we radiated everything and all that to our food, we'd get it. But they're the thing that's nice about spore formers is they get through the acid of the stomach down into the intestines, right? And they don't need to be refrigerated. They themselves do not set up shop within your intestines, but they promote other bacteria working better. And maybe that's where their action comes in terms of binding.
Mm. Okay, thank you.
You're welcome. All right, let's move on here.
Please don't get to me yet.
Oops, somebody, I'm hearing a voice in the background there. So whoever's got your microphone, oh, Jackie,
Sorry.
you need to mute yourself here.
I'm sorry.
No problem.
Hi, and I'm sorry.
Hi, no problem. I'm gonna mute. I just muted Marilyn too. There you go. Thank you. It's just means of keeping everything a little quieter over here then. All right. Let's see. That. I think there are a couple of people said they couldn't hear me. That's because I wasn't talking yet. I don't start talking until you see my video feed, basically. All right. All right, Lee, let's see. In the midst of my mold illness, I have developed chronic gastritis, which I thought was GERD. It's not responding to Pepcid or omeprazole. They now have me trialing sucralfate, but the side effects and added reflux are unbearable. I am currently doing marshmallow root, DGL, aloe, random antacids. I was hoping you could comment on the idea of alternatives such as slippery elm, DGL, zinc carnosate, and Biton spilosa. And if you had other suggestions, we very much appreciate your time, Lee. Thank you. You're welcome, Lee. So Lee, I'll make some comments about the list of supplements there, but the one thing to look at, and I hope your doctors have looked at this too, is to review your medications and see if there's a medication that is actually triggering the gastritis. And so sometimes as side effect, you can get that. Somebody should have gone through your list and just make sure you don't have a side effect issue with one of your medications. Okay, so I'll just throw that out, something for you to ask your docs about. Okay, and then a quick question for you: Did they actually scope you to look in your stomach then too?
Yes, and we're awaiting the biopsy results for. I think they're checking for yeast and a few other things, but
okay. And then do you know, I assume they're probably going to be looking for H. pylori as well too.
I believe so, yeah.
So, part of when you get into a difficult situation like this, there's two things that I wonder about. One is this really well, three things. Is it a side effect of what you're taking? Number two, is it due to bacteria called H. pylori, in which case you need to kill the H. pylori, basically. Unfortunately, I don't have a good herbal way to do that. It's usually prescription antibiotic regimens to do that. And so they're going to be looking for that, okay? And then the third thing, which is not going to be on the eyes of the conventional doctors, of your conventional gastroenterologist won't know anything about this, but there's actually, if you happen to not have enough stomach acid, you can get gastritis as well too. And so sometimes if you could find the way to figure that out is there are functional medicine doctors that will do something called a string test, where they'll drop a monitoring device down into your food pipe and see are you and in your stomach and try to figure out what is your acid levels like. And if you don't have enough acid, sometimes actually giving acid is going to give you relief. And one way to do that is with something called betaine. You may have heard people using betaine before, but you might even want to see, talk to your gastroenterologist. Some of them may be enlightened and just say, is this possible that we're dealing with low stomach acid, and can you test for that? And if you do, then the treatment, and I don't have the protocol off the top of my head, but betaine stomach acid is the way to go ahead and do that. Okay.
Yeah, brought it up and it went over like a lead balloon.
Oh, yeah, but it could be, or you may need to find a functional medicine doctor. You may, and you know, the way to find a functional medicine doctor is there's a group called the Institute for Functional Medicine, IFM.
Oh, right.
Yeah. And they actually do have a doctor finder section there. And, you know, it could be just something you see them a couple times just to figure it out if that's what's going on with you, basically. Okay. All right.
Okay.
Yeah. And then in terms of your list, you know, you're on some good thing. I mean, the marshmallow, the DGL, aloe, you're doing great things. I mean, you might get some benefit from throwing in the zinc carnosate. I haven't actually used zinc carnosate, but I could see, knowing how it works, it might benefit. Slippery elm may benefit. Bidens may benefit. But I guess what I'm suggesting is I think you still got to figure out why it's happening.
Gotcha.
Yeah.
Yeah.
Okay.
We think of, I don't know if you recall, but before I had all the phlegm thing in my chest there, and you were like, that sounds like yeast.
Mhm,
And then I
mhm.
started the probiotics, and 3 days later it was gone. And then suddenly, the reflex here, I thought it was reflux, and then turns into gastritis.
Yeah.
Um,
Yeah.
filtering, but it's awful. I'm down to 2 foods. I'm dropping weight way too fast. It's like,
Yeah,
oh,
no, that's not good. I'm sorry to hear that, actually, but yeah. But no, you may need to get some help from a functional doc to see if they can give you some answers on it too. Because the
okay.
trouble is, the conventional docs are just going to drug. They've already done it. It's not working too. So yeah, yeah.
If you don't mind me just to expand one more, I'm wondering why the pepsids and stuff, they're making things worse. I was just really,
Well, that's why I'm wondering if you have low stomach acid. Actually, that's causing
oh,
this. Yeah,
gotcha. Because I've used them before in the past when I had GERD, and they worked
yeah.
worked wonderfully. Now it's
Yeah,
like,
no. The reason
acid.
I should have said that to begin with.
Oh,
If they're making them worse, then you really do have to start wondering about, is it a low acid problem actually?
gotcha.
All right.
Awesome. Thank you very much.
Yeah, good luck to you.
Thank you.
Does anyone have follow-up questions to what Lee was talking about there? All right, let's move on here then. Good luck to you, Lee.
Thank you.
Hello, Deborah. Let's see. Would you give your opinion on taking your protocol for the 3Bs in conjunction with prescription blood thinner Xeralto? Ugh. So you just heard me groan, and the reason you just heard me groan is I have no idea whether these herbs are going to interact adversely with that or not. They're just, no one's done the studies on that. If you were to Google, you might find some offhanded remarks that says herbal antibiotics aren't good to use, but there's no studies. And so unless they could look at using a different blood thinner with you, I cannot say that doing the crypto Japanese knotweed, cinnamon clove, oregano is going to be a good idea, because it could, I said could, interfere with the Xeralto, but there's no studies that look at that at all. Sorry about that, Deborah. Does anyone, Deborah, do you have a follow-up on that? All right, let's move on here. Let's see. All right, so JS Rosedale, let's see, how long should you take Tafenoquine for Babesia? So, you know, like, there's two parts to that. Is how do you know if it's working? And then how long do you take it to get rid of the germs, right? So generally with Babesia, if an agent is working, you should start seeing some improvements in your Babesia symptoms within about 2 to 4 months. Okay. All right. Now, on the other hand, Tafenoquine is so strong that sometimes what you're getting in the first 2 to 4 months is Herx reactions, Babesia herxing. Okay. I tend not to see the Babesia herxing uh, with other agents the way that you might with Tafenoquine. And what a Babesia herx would look like is night sweats, more air hunger, headaches. So worsening Babesia symptoms, basically. That's what it's going to look like, okay? So if you're on it and you're worse for being on it, it probably means it's working. And it just may be a matter of time. And then but if you're not getting any herxing and you're not feeling any improvements by, I say, the 2 to 4 month range, I would start looking at what else do you need to add to it, or do you need to go in a different direction? Even though it's a wonderful medicine, it's really made a big difference for a lot of people with Babesia. It's not the medicine for everyone. Nothing's for everyone. Okay, all right. In terms of how long do you treat Babesia, so I would say for 85% of people with Babesia, and it doesn't matter the strain, treatment is 5 months for 85% of people. Okay, all right. But a lot of people that are here are in that 15% group that it's just a longer, more difficult course. All right. So, so of the major Babesia strains that we know about right now, we know about Babesia microti, which is the original, probably East Coast strain. There's something called Babesia decani, which we thought was predominantly a West Coast strain, but it's on the East Coast now too. And then more recently, there's a discussion going on about whether people with chronic Babesia have something called Babesia oticoli. All right. Now, Babesia oticoli is predominantly found in deer populations, but it does look like it is dog populations. I'm sorry, dog and deer, but it does look like it is. There's starting to be some evidence that it may be in humans. And the thing that makes it different in humans than other Babesia strains is it has the ability to sequester itself, hide itself away in these Babesia nest of Babesia and fibrin. Okay. And it's more difficult to treat. And so sometimes you just have to spend time continually working with your lumbar kinase to peel back the fibrin to get these germs exposed. And as you do expose one layer, you get killing, and then you go back in with more of you keep working with your lumbar kinase to bust up the fibrin. And so you just, if you really have a lot in you, it's going to take time to clear out those fibrin nests, basically. All right. In terms of Babesia microti and decani, they're probably not fibrin nest. So there's starting to be, there's limited science here on the whole decani or oticoli thing, but there is some opinion that maybe people with really chronic, difficult to treat Babesia probably is all oticoli. And then it's just a matter of continuing to work with your lumbar kinase, that one pill, maybe one pill twice a day, and staying on a tafenoquine and working a strong tafenoquine treatment would be tafenoquine with azithromycin with atovaquone thrown in. That would be a pretty solid tafenoquine based treatment. But don't forget to do the lumbar kinase. Okay. And again, we think that it's oticoli that needs the fibrin busters to get rid of those fibrin nests. It's not microti and it's not decani, basically. Right. Did that answer your question for you?
Yep, that was great.
Okay, good, good. Does anyone else have follow-up to that too? All right, let's move on here. Good luck to you.
Thanks.
Let's see. Sandra says, I have one MTHFR mutation. Is it okay for me to take 1/2 teaspoon of MSM daily? All right. So, the thing about, so MTHFR stands for methotetrahydrofolate reductase. That's a mouthful, right? And anything in medicine that ends in ACE means it's an enzyme. Okay, so this is an enzyme called the methotetrahydrofolate reductase enzyme. And what its job is to do is it's supposed to take diet folate and activate it. I'll call it activated folate. All right. And the form of activated folate is called 5-methyltetrahydrofolate. It's a mouthful. All right. So there's a gene that determines what this enzyme, the MTHFR enzyme, is going to look like, right? And the gene has two major genes that determine it. There's something called the C677T gene, and there's something called the A1298C gene. All right. Now, keep in mind, when we have a gene, we have a part we got from our mom, and we got a part we got from our dad. All right. So you potentially, of these two genes, because there's a mom and dad component, you have 4 potential defects. All right. All right. Your biggest chance of having what I have found in my practice is a single defect results in nothing. I have not found benefit in treating by taking 5-MTHF for a single MTHFR. Where I have found benefit is if I've got somebody that's got 2 mutations at the same gene, so 2 A1298Cs or 2 C677Ts. Those are the situations that I find benefit. All right. But beyond that, for a single agent, I've never found benefit for treating it, and I don't worry about limiting anything for people in those kind of situations either. All right. Sandra, did that answer your question for you there?
I have a lot of trouble detoxing heavy metals,
Yeah.
in particularly mercury and lead.
Yeah.
And that's using IV EDTA. Several times I've done that, and I just have trouble getting the heavy metals down.
Yeah. But I don't think that would have anything to do with MTHFR though, because MTHFR is so the ultimate fat detoxer in our body, or fat toxin detoxer, is glutathione. Okay. And there's a number of chemical reactions that have to take place before you get glutathione. The first step is taking your diet folate and turning it into this activated folate, right? And so if that doesn't happen, then you don't get enough glutathione. But I would, even though glutathione has some detoxing ability for heavy metals, I wouldn't call it a major detoxer of heavy metals. And so I don't think that is why you would be having a hard time getting rid of your heavy metals.
I'm assuming then it would be good to take B9, I guess, which is folate. And then would there be any other supplement that you would suggest?
Are you saying to correct for the MTHFR or for another reason?
Just to help out with like building muscle strength, that type of thing.
Yeah, so you know what you could do is just go to taking glutathione. Just skip. I mean, if there's any concerns you have at all about MTHFR, and again, I don't think you need to worry if it's just one defect, but if you're concerned about that, the better way to really build glutathione is to take glutathione and to take liposomal glutathione. So glutathione can be horribly absorbed unless it's the right form. And for that reason, that's why I recommend this Trifortify product. Research Nutritional's done some great studies showing that their product does result in pretty substantial increases in red blood cell levels and some other markers that they looked at too. So that would be a way to do it, a teaspoonful 1 time a day of that.
Okay, thank you.
Good luck to you.
Thanks.
Tracy, I see your hand up there.
Maybe you just answered it, but you said you wouldn't do anything unless you had a double mutation. What if somebody's compound hetero, so they've got one mutation, the 1298 and one on the 677?
You know, again, I never saw much benefit from treating for that either. It is interesting that, you know, when we first discovered this MTHFR, what, about maybe 10, 15 years ago, everyone was jumping on the bandwagon and trying to correct for every single defect or even a defect like that. And I think most of us have kind of walked back from being that aggressive because it just doesn't make much of a difference.
Okay, good to know. Thank you.
Yeah, yeah. Hello, Katie. Let's see. Can you speak about cavitations and success in healing after they are addressed? Is it worth testing through DNA connections? So let's talk about cavitations first. So cavitations, I assume you mean dental cavitations. So they would be little pockets of infections that sit at the base of your teeth, basically. So it is true in people where cavitations are an issue, getting rid of those cavitations in a how can I say this? Not in everyone, but I would say a significant amount of people do get benefit. All right. Because what can happen with those cavitations is they can be pockets of Lyme infection, basically. And so 2 ways to get rid of a cavitation: either pull the tooth out that's sitting above it so that you can get in there, or you can sometimes find biologic dentists that will inject ozone or even hydrogen peroxide into the pockets and get rid of the infection that way too.
These are in my son's wisdom teeth sites where the wisdom teeth have been removed.
Yeah. In that case, if they've been removed, you might see if they can see the pockets, if they can actually see them in there, then injectable ozone or hydrogen peroxide in there sometimes can make a difference.
Okay. They're suggesting we clear them out, scrape the bone. They said the bone is not growing.
Yeah.
It's quite an involved procedure, and it's questionable if it's worth it. So
Well, are you working with a biologic dentist at all or not?
yes. So
Okay.
I typed up a lot more history, but it wouldn't take all of it. So in October, he had his wisdom teeth out, all 4 of them. And then like 5 weeks later, he ended up with an infection in one site.
Oh.
And they did metronidazole along with clarithromycin, which he was already on.
Yeah.
And that was brutal on him. But for about a week after he was off of that, he was the best he's ever been. Like it's all this treatment. And then he started to slowly get more and more tired, fatigued, like usual. And then his face swelled up again. So they did the antibiotic again. And he's never really gotten back to that, that 1 week that was really good. And so then our practitioner we're working with, she said, well, maybe you should have a cone beam done to make sure there's not really a lingering infection.
Yeah.
And we did. And that doctor is saying that the bone isn't growing. So he's got to go in there and scrape it and ozonate it. And
so he is talking about ozone then too, but
yeah, but not just injecting it, like cutting it all open and cleaning it.
So the concern I have from what you just described and how you're describing it may be different than what I'm about ready to say, but if they're getting ready to go in and scrape, that makes me think they think that there's infection into the bone. And and that you do, if you've got bone infection, they can be really hard to get antibiotics to penetrate. You can, but often it's going to be months of treatment, not just a short course. And your dentist may even be thinking maybe they left part of the tooth behind or something. They're probably wondering, is there a foreign object in there that allowed the infection to spread? So yeah.
He said it looked clean, but he was concerned because the bone didn't regrow at all.
That's what I'm saying. They probably want to go in and look to see if there isn't a part of a tooth left, not just a pure cavitation, but part of a tooth left. But also if it's in the bone, sometimes literally scraping that part of the infection away is where to go, which is a little bit different than a cavitation. A cavitation is literally just a cavity, like a pocket that's there.
All right.
You're describing something that's a little bit different than that.
Okay. And then, so if we already know he has Lyme and Bartonella, is it really worth paying the money to send it off to get tested? Do you think?
No.
Okay.
If you already know he's got it,
expensive.
you're not going to get any added information by doing that. Yeah.
Okay. Thank you.
You're welcome. Good luck to you. Good luck to your son. Yeah.
Thank you.
All right. Did anyone else have a question? Follow up on that? All right. Let's see here. Jackie, I don't see a question. I just see the word help. I'd be glad to help you. I like how everyone writes questions and yours is straightforward help. How can I help you? Oh, I need your microphone on. Hey, Jackie, I know you're talking. I just can't hear you.
Hi, Dr. Marty.
Yeah, hi.
Hi. I don't know if the camera's on. I put myself in a dark room so I participate and you can't see me. So I don't know if it's working. I'm sorry to just do the help.
I can see you even though you think you're hiding from us. Yes.
Oh, no. I'm trying to be like courteous. It's like 30 seconds left until, the satellites in the sky read our every emotion. Okay. I'm like totally scared about that. So I have a quick question about myself and then for my family member that's so important. And honestly, I kind of thought you'd find help funny, but it's like crazy. So I didn't know how to put it.
Sure.
For myself, please, I just have one symptom that's really annoying, and I was wondering if you had any thoughts on it.
Mhm.
I am more stressed lately, and I'm on less medicine because I'm disorganized and just can't find the Klonopin and Neurontin. So I had this trouble yesterday. It really freaked me out that I couldn't swallow. And I can swallow water and things like that. It's weird. And then I think from trying, it felt like the muscles or something were sore. I don't know. And I thought I had a germ and it was gone. And maybe because I'm stressed, it came back. So I don't know. I looked it up and it said neurological.
Mhm.
And I have the markers for MS. You know, obviously I don't have it. So I was just wondering if you've seen any patients with that, if you had any thoughts, or is it just like I'm special in a bad way? And then I'd like to ask you about my family member. That's like way more important.
So quick
Please.
question. Have you done antibiotics for tick-borne infections then?
I'm so scared. So in 2017, I did doxycycline I'm going to hide in the bathroom. It's like, I'm not even like in a house. I'm in a physical rehabilitation center.
Mhm.
I hope you can see me less. Okay.
Yeah. So to
27.
clarify, so you have been on antibiotics before though?
No, for a strain in 2017, I took 21 days of doxy, and on the last day, I had a grand mal seizure. And I remember all the way back then, you were awesome, and told me another time you thought maybe advised, or I don't know how to put it, to take curcumin double. I'm sorry, I'm like having an anxiety attack. So that's the only time I took it. And then I realized I was having seizures all along. I just didn't know it. So
Okay.
I've never treated it.
So here's why I'm asking it. So when you have difficulty swallowing, the things it could be psychologic cost.
Probably.
Stress. Okay, stress.
Yeah.
Do that. Okay. It could be a neurologic difficulty of your food pipe getting the signals to be able to move things through, which could be
Right.
Bartonella and Borrelia, for instance. Okay.
Yeah, I have
And
those.
then the third thing is sometimes people will develop, not only can you get intestinal Candida or yeast overgrowth, you can get food pipe intestinal, or not intestinal, but food pipe Candida, and that will make it difficult to swallow as well too. So I would
That's not
suggest,
good news.
yeah, but if you continue to have the difficulty, you may need to actually have a throat doctor take a look down
Oh.
and see if they can see what's
See,
going on.
I like to blame everything on Lyme, even though I remember you saying not to have your Lyme blinders on.
Yeah, 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 yeah.
And anxiety and everything. Okay, I appreciate that. Maybe hopefully if I find the Neurontin and Klonopin, that'll help, because just stress making everything worse. That
It
being
could,
said, obviously waiting so long is not in my
yeah,
favor.
yeah. So how can I help your family member then? Or
Yeah,
what?
thank you so much. This is like
You're
a
welcome.
very urgent matter, because I love her so much. I'm being vague on purpose for her. Okay. So she had a laceration. Of course, I took notes and it's gonna be all screwed up. On her hand, which naturally turned into cellulitis. Urgent care diagnosed it. Antibiotic didn't help. I don't know which one. So luckily, just the ER, so she didn't have to go in, because that's like a nightmare in our family. Doxy, 100 twice a day. And
Yep.
then her primary suggested infectious disease. But me being an idiot, I'm like, no, it's helping. So of course I can blame myself for everything. So she took more doxy, and then everything collapsed, like trouble with balance and coordination. In the house, luckily, or apartment, so she never got hurt. She never hit her head, but she started falling seriously like 2 to 3 times a day. Me being, I could totally blame myself. Like, I know what I'm doing. Like, stop the medicine. Like, obviously, in retrospect, we should have, done some kind of, but what, I don't know. But neurologically, really big decline. And it was kind of funny in a way, because she was so kind to me and saying all these nice things, because she didn't know it's me. And she'd be like, you're just like Jackie, and you got to meet her. And then the last 3 nights, it got very bad. She got like paranoid and thinking I'm after her, and thought people are there, in the house. So then I'll try to speed this up. Basically, she went to an ER, and in my family, that's like the hugest fear. Do not go to a hospital,
Mhm.
And we try to stay in the emergency room. Oh, she basically, I had to hold her up in the car and she was mildly tremoring. She doesn't convulse from seizures. And she was it went from tiny little yes or no's to squeeze my hand if you hear me to like, I saw her breathing was okay, but not responsive. So I had to call ER and it seemed her breathing was okay. I don't really know for sure. So then she was told she has low hemoglobin, if I'm saying it right, low iron, way low blood pressure, and there probably was something else I can't remember. Blood transfusion, IV fluid, second one helped a lot. And I'll try to see my notes real quick so I don't screw this up. And I'm very grateful for any thoughts you have, obviously.
Hey, Jackie.
I have to shorten it.
No, well, I can tell you already, this is going to be too complicated for me to figure out here.
Oh, I guess the question, to simplify it, I'm sorry, is it was just a terrible nightmare in the hospital. So basically the question is, now the person, she has a UTI, so we definitely want to avoid a Herx. And I don't know, like, we have your supplements that we ordered.
So question, does she have tick-borne infections too?
Oh,
Is that
yeah.
Okay.
I knew because I just assumed she had Babesia,
Yeah.
and I just feel Lyme, Babesia, and Bartonella.
Okay. So one antibiotic that you could use for a bacterial bladder infection that tends not to kill tick-borne infections.
Oh, wonderful.
Is something called the trade name is called Macrobid. It's also
Okay.
known as nitrofurantoin.
Macrobid or nitro, what was that, please?
So Macrobid is the generic name for Macrobid is nitrofurantoin. NitroFurantoin.
Okay, great.
And when I have used it, in theory, I mean, there's no data I've seen that says that nitrofurantoin does any of the tick-borne infections, kills them. But also, I've tried it in my practice when I'm looking for something for bladder infection and somebody that tends to Herx for tick-borne infections, and I have not seen it lead to tick-borne infection Herx at all.
Okay, wonderful. Is there a certain dose, or is it typical, whatever, that you would give in your practice?
Usually I'll give it at either 50 milligrams twice a day, or if somebody's got a severe infection, I might go 100 milligrams twice a day.
Okay, I appreciate that so much. And then two very quick things. I just want to advise everyone on here to please, I don't know what it's called, but the medical power of attorney. So if somebody gets hospitalized, because they would not let her out, wouldn't hear about Lyme disease, even the test that's 95% accurate, shut me down, wouldn't even hear about it, and was stuck forever. And then she's been using the curcumin that we got from you, and we have like everything you recommended. I'm just not on top of things. So I know glutathione may cause me to Herx because my Lyme is advanced, as someone put it. We have like several you recommended, or a few that, you carry. Is there anything that you think would be helpful now, or wait, would you think, until after the antibiotic? Because we definitely don't want to Herx. But you said she won't, so actually it sounds fine.
I don't think she will.
Okay.
Yeah. All right. And just
yeah.
real quickly, when you said you Herxed on glutathione, it's not technically a Herx. Probably what happens.
Okay.
There's the one thing that could happen with glutathione is if you've got blocked detox pathways and then you take a detox chemical like glutathione, basically you've opened up this barrier and now you get movement of toxins, which triggers more cytokines to be made. So often for people that are having that trouble, you just have to go a lot lower on your dose of the glutathione.
Okay.
Yeah.
Okay. I'm so grateful for your thoughts, and we're going to step it up with the supplements.
Yeah.
And I can't wait for us to heal with your recommendations, suggestions, however to put that, thoughts. All right. God bless you if you have faith. If not, we're so grateful for everything.
Good luck to you and to your family.
Thank you so much. You're the best.
And I see your hand up there. Is this a follow-up for one of our earlier questions, or this one?
It's a different question. Is that okay?
So I see that you've written one here. Is it the one you wrote down?
There was, I wrote two at two different spots, but yes, it's those.
Tell you, generally I'll go in order, but I'll take it for you.
Oh, no,
which one? No. So go ahead. What do you want to talk about?
Oh, I just want to know what your recommendation is for H. pylori.
Yeah.
I'm having a hard time. I have so many things. I have such a pileup that I just can't seem to get anywhere. And I'm thinking maybe I should start with H. pylori. Not start. I've been sick for 13 years, but yeah, that's one question.
So in terms of H. pylori, the only time I treat it is if somebody is actually symptomatic with it, meaning they have.
I am symptomatic.
Okay, right. Because the reason I say that is there are some GI profiles that people get that will say they have antibodies against H. pylori, and then doctors will say you need to treat it. Well, no, antibodies sometimes get rid of the infection. So right. Okay. So this is one. I usually have to look up the various regimens these days. I don't have one off the top of my head. I usually, if somebody comes in my practice, I'm going to investigate what I want to do in terms of it. Okay. But generally you're going to be on some type of an acid blocker. And then there's going to be a couple antibiotics you're going to take with that. And I just don't know them off the top of my head. I'm sorry about that.
That's okay. My other question is, whenever I try to kill, I had Lyme and 13 co-infections. Now I'm down to Lyme and 2 forms of Babesia.
Yeah.
But anytime I try to kill anything, I get super depressed. It doesn't matter if it's antibiotics or herbs or ozone or, and I mean like really intensely chemically depressed. And I take binders and it helps a little bit. And I've done IV glutathione, it helps a little bit, but it's really hard to remain on anything because the depression gets very severe.
Yeah. So what I've seen with that is it's likely one reason it could be happening is cytokine related. So cytokines can give a whole host of symptoms, and it all depends on who you are, the symptoms you get. But one of the groups of symptoms you can get from excess cytokines from killing a Herx reaction is mental health issues. And what I've had to do with patients that have that problem is I would just start doing regular IV glutathione or nebulized glutathione. So if you get it made for nebulizer, it can it's cheaper than getting injections twice a week, for instance, and you can do.
I actually have that and I have been using it.
Yeah.
Yeah.
Is it helped?
Not when I really try to go after things. It doesn't help enough. It helps a little bit.
Well, you may need to pace how aggressive you're being with your germ killer versus, it's a balance. You got some help from glutathione. You're trying to be aggressive, but you may just need to find a balance that you can tolerate there.
Okay.
All right. Sorry about that. Yeah.
That's okay. Thank you.
You're welcome. Good luck to you.
Thank you very much.
You're welcome. Lee, I see your hand up there.
Sorry about that. I don't know if you recall my first question about the chronic gastritis. I forgot to add in that I have mast cell. Would that change any of the dynamics or?
Other than that's another factor that's going to keep you not feeling well. No, it's not going to change how I would approach the stomach issues that you're having or the recommendations that I made earlier.
Okay. Thanks. Okay. Sorry. Thanks very much.
Yeah. Good luck. All right. Let's see where we are here. All right. So J. Rosa, I think or JS Rosa, you've got a number of questions here. I'll just try to be quick with these. Let's see. I use infrared sauna to detox from mold. Should I take binders before or after? All right. So when you heat up, whether it's a bath, infrared sauna, a banya spa where they get up to 200 degrees, whatever it is that you're sweating, what happens is that mobilizes toxins that are stored away in your fat. And roughly 20% of those get sweated out. The other 80% go to the liver, and then the liver has to process them. Okay. And in the case of mold toxins, it doesn't process them. So it's going to move those toxins out into the intestines. So And people that are really binder sensitive, that it always flares them up. Sometimes I will just have person do 3 times a week sauna treatments, and at least be able to start moving 20% of those toxins out, right? But if you can tolerate taking a binder and doing your sauna, yeah, it would be probably a good idea to do that. I would probably take them. I would probably take them about, I mean, there's no clear guidelines on this, but I'd probably take them about a half hour before you hit the sauna, so you've got them in you. And that way, when and that's probably what I would do, is have them on board, basically. Okay. And then let's see, can you take Japanese knotweed cryptolepis together at the same time? Yes, you can. And can cholesterol be used as a binder for mold toxicity? I don't know. I've never used it that way before, so I don't know that one off the top of my head. Okay. All right. All right. Let's see here. So J. Roselle, do you have any questions then, or did I kind of get at that for you?
So the binder that I take a half an hour before a sauna, or could I take it at night instead?
You could. I mean, you've got the heating effect is going to mobilize those toxins for a while. They're going to be recirculating, so you could take it at night if you want to.
Okay.
Okay. Good
Thanks.
luck. You're welcome. And then Joe, I see your hand up there.
Hi, I'm
Hi.
can I say something about the person before last, for Jackie?
Sure.
Just, I've had experience with treating UTIs, and treating them with kefir applied to the area has worked very well. Obviously unsweetened plain. I've used coconut kefir, and it cleared it after 5 months of a UTI. It cleared it up in a week.
Yeah. Interesting. I haven't done that before, so thanks for sharing that. But so yeah, I would think if it's going to do something, it would be through a probiotic effect, possibly. But I wonder. Yeah.
I'm sure that's what it was.
Yeah. Yeah.
And antibiotics hadn't worked for me as well, so I was really relieved.
Interesting.
Yeah.
Thanks for sharing that. Yeah.
You're welcome.
Good.
Thanks. I'm going to lower this now.
Let's see, Melissa, I see your hand up there.
While we're on the topic of binders, do you have any recommendations on how often to take those, just in general through treatment, kind of as a preemptive thing, not associated with mold toxicity?
Yeah. So in my practice, I generally didn't use binders except for if somebody had mold toxicity issues. At one time I did, I just didn't find any general benefit from doing binders, basically.
Okay, would they be helpful with yeast or not really?
No, not really.
Okay.
Yeah, what I would say is it's hard enough taking treatments for the tick-borne infections. I would try to uncomplicate it if you can by not taking a binder unless you absolutely need to, right?
Okay.
Because it's already, I mean, by the time you have to schedule when you take your binder and everything else, it just adds another layer of complication.
Okay, thank you.
You're welcome. Let's see, Jim, I see your hand up there. Jim? There you are. Nope. Hi, Jim. Hi, Jim.
Jeez.
Oops, your microphone's off again.
Let's hope it stays on now.
It's
yes.
on. Yeah.
Okay. Oh, yes. So this is back to the mold question also. What is the role of the G6PD, and does it really matter if one is in this group that is genetically handicapped at removing toxins?
So did you say, I want to make sure I understood you. Did you say G6PD?
Is that the correct blood test for the mold?
No, there's not. Oh, I'm sorry. There's something called HLA-DR testing. Is that what you're talking about? It's a genetic test?
Oh, I'm sorry. G6PD is for methylene blue, right?
Yeah,
Is that right?
G6PD is needed to have enough antioxidants in your blood vessels, and if you don't have it, or in your blood cells, I'm sorry, and if you don't have enough, and you take methylene blue, you could get hemolysis, basically. So that's a different issue.
Yes. Okay. So my question, I actually did mean to ask about the one that starts with H and has to do with mold clearing.
So the HLA-DR testing, which is one of Dr. Shoemaker's ideas. So Dr. Shoemaker was the person that discovered this thing called mold toxicity. And basically, again, just quickly, what mold toxicity is 25% of people do not make effective antibodies that tag mold toxins. And since the mold toxins don't get tagged, they don't get broken down. What happens in 75% of people is our immune system sees a mold toxin, sticks antibodies on it, that signals other white blood cells to come in and remove, eat up, destroy, get rid of the toxins. Okay. So in 75% of people, we don't have problems at all. All right. Now, Shoemaker showed that there is a test. It's a genetic profile that he says indicates that you would be one of the 25% of people that have genetic programming errors that make it so you don't make the effective antibodies. All right. The problem is with that test is it's a genetic test. What your blueprint says about you does not always manifest, because the blueprint has to be interpreted, and we call that interpreting of the DNA blueprint. We call that epigenetics, and how that gets interpreted may not cause any kind of problem in the end at all. All right. In other words, we're not our genes entirely. We're actually our environment applied to the genes, basically. All right. So it's just having the defect does not prove you have the problem. And secondly, I have seen in the early days when I was using his testing, I saw a number of people that I decided to treat for mold toxicity anyhow, and even though I had negative HLA-DR testing, and they got better. So it doesn't pick everyone up, all right? And so generally, in some of my more recent material, if you saw that article I put out about updated by mold toxicity, I reviewed in there the 4 ways you can really test. One is urine test to see are the toxins really in you. The other one is an antibody test. And the reason I don't support antibody testing is just measuring antibodies doesn't mean they're accumulating in you. Maybe you're making antibodies because you have an ongoing mold exposure and the antibodies are effectively destroying those toxins. So even though you have elevated antibodies, they may not be accumulating in you. So I don't recommend that way. Okay. There's the HLA testing, which I already told you I don't like. And then Shoemaker measures a bunch of inflammatory markers, something called C3A, C4A, TGF beta 1. The trouble is, and then he says if you have those are elevated, that means you have mold toxicity. Well, other things can cause them to be elevated, including tick-borne infections. So that doesn't prove you actually have it either. So the only proof test is the urine mycotoxin study, basically.
I've had that positive, and I was positive for all the categories.
Yeah, yeah. That to me is the more accurate way of doing it.
So just follow the binding protocol and sauna.
Saunas can help.
Is there anything else besides those 2 things?
Those things, and then if you have done a decent trial binders and you've done your saunas and you're not making significant headway either in how you feel or your toxin levels aren't coming down by around 6 to 9 months, then it's time to start wondering, do you also have colonization with mold spores that have set up and are producing their own toxins, meaning you become your own brew pub, basically. But I usually don't think about putting somebody on something to kill mold spores until we're about 6 to 9 months in treatment, because in my practice, 90% of the time I got people well without ever having to resort to that. So in my practice in Seattle, Washington, I tended to attract people that did not have a mold spore pollinization or mold spore colonization issue. Okay, now on the other hand, Neil Nathan, who many of you know in the mold space, Neil Nathan attracts people that are in their last rope And by the fact he's attracted the sick people that have failed everything else, there's a high chance they probably are colonized, right? So he would tend to go and put people on antifungals early. He even waits a little bit, though. Even with his practice, he doesn't do it right away. But yet, often he does wind up having to put people on antifungals in his practice to get the mold spores.
How long a course is that?
You know, I have had people with just binders alone that we did 6 months of treatment and they were healthy as all get out after 6 months. People that had came to see me that had positive Lyme testing as well as, and then I took their history and I discovered by history they probably have mold toxicity. I never did anything to go after their positive antibody test for Lyme, just did mold binders, and in 2 or 3 instances, I got people 100% well with just 6 months, 100% well. Okay. On the other hand, I have had people that it has been an arduous task of chasing mold toxins, sometimes getting them on antifungals that can be a 1 to 2 year experience to get them well. So it all varies. And part of the problem is it's really hard to live in a clean environment. It's just hard. It's hard, even if you think you are, even if you've had your house remediated, it's just hard to live in a clean environment, basically.
Okay. Thank you.
All right. You're welcome, Jim. Cindy, I see your hand up there. Cindy, are you still there? Cindy Hughes, I'm talking about. All right. Well, I'll move on here then. Let's see here. Let's see here. All right. So somebody's got their microphone on and I'm hearing black spattering. Oh, Jim, I'm going to mute you here. Okay. There you go. All right. Let's see. I think this is Tracy again. Let's see. In your mycotoxin table, spore-based. Oh, we already talked about that.
Yeah, you answered it already.
Got
Thank
it. Okay, got it. Yeah. All right, Kelly, let's see. What is the most effective way to manage an IgM, Borrelia, Andersoni, and EBV contributing to joint destruction? Could ozone work? All right. So, Kelly, welcome here. I know you. I think you just joined the Lyme United earlier today, if I'm right. So it's pretty bold being here on the first day and piping up with a question. So good. All right. So I think so the Borrelia, in terms of the Borrelia and EBV, I don't tend to think of EBV, which is Epstein-Barr virus, monovirus, as giving joint problems. It may give fatigue, but I don't see it as giving the type of inflammation you see in the joints. Borrelia, on the other hand, can affect your joints in a couple ways. One is your immune system can react to Borrelia in your joints, leading to increased production of cytokines that give you a lot of the pain in the joints, okay? Number two, Borrelia likes to burrow as far away from blood as it can. And the reason is oxygen in blood can kill Lyme, right? So Borrelia likes to burrow into your connective tissue. So it likes to get into your tendons and your ligaments. So some of your joint pain could be it literally in your ligaments, okay? But it also can burrow into cartilage, and you can get wearing down of cartilage in the joint. So when I've got somebody that has a lot of joint issues, first of all, I'd like to make sure that I'm doing something anti-inflammatory with them to target the cytokines, all right? And so when your white blood cells see Borrelia, they manufacture a bunch of chemicals called cytokines. Cytokines are good and bad. Cytokines, on the one hand, will turn on your immune system. But when you get cytokine excess, as we often do in tick-borne infections and in COVID and in too many yeast in your intestines, they then start giving you problems, okay? And one of those can be pain. One of the things that's useful to knock down cytokines, there's two that you might want to try. One is I like working with liposomal curcumin. I like liposomal because curcumin is a component of turmeric, and it's just not well absorbed. So you need to have it prepared in a way to get absorbed. And so I like using a liposomal variety. So for instance, Thorne makes a product called curcumin phytosome, which is liposomal curcumin, okay? And it's a 500 milligram pill. You want to do at least one pill 3 times a day. Also, and what that does is it gets inside white blood cells and interrupts the production line of cytokines, basically. It's in the factory and it creates chaos in the factory, okay? But the other thing for cytokines that you want to do is you want to block the signal that tells white blood cells to make cytokines. And the signal that tells white blood cells to make cytokines are oxidizing agents. And the immune system, when it's fighting infections, will make a lot of oxidizing agents to also fight infection. So you want to lower some of those oxidizing agents. And what can be useful at doing that is liposomal glutathione. And that would be a teaspoon a day, okay? And the product I like for that is a product made by Thorne, Research Nutritionals called Trifortify, mainly because they've got science showing good absorption, basically. Okay. And then finally, again, you may have some cartilage injury here. And so the science is kind of hit or miss on this one, but I have seen benefit. And that is to try to support your cartilage by giving it some of the building blocks. And so one of the good things that's a building block is glucosamine sulfate. Sometimes you're going to find it paired with chondroitin sulfate. You could do either glucosamine sulfate by itself or a glucosamine chondroitin sulfate. I find it works about 50% of the time. It's not a fail-safe, but it works about 50% of the time. Okay. So those are some things to think about. And then obviously, if you've got tick-borne infections, you got to treat them. I don't think it would be the EBV. So it's the Borrelia. You've got to start taking something that's going to knock that germ load down.
Is that your product with the clove oil and the garlic?
So these days, if you're looking for, if it's just Borrelia that you have and you don't have Bartonella and you don't have Babesia, if it's just Borrelia you could probably do it with, you might look at using a combination of Cryptolepis coupled with liposomal cinnamon, clove, oregano, okay? And the reason I'm going for those these days is we're now starting to be aware that with Borrelia, one of the things that blocks improvements, there's 2 things. Number one, Borrelia is not all in a growing state. In fact, a small percentage is in what's called persister or hibernator state, okay? And lab evidence that came out about 4 or 5 years ago now from Johns Hopkins tells us that those oils, along with crypto, are quite effective at getting at the persisters, all right? And in addition, in lab experiments, they're quite effective at going after growing state as well too, okay? The cinnamon, clove, oregano also can help interfere with, let me get that. All right. Let's see. I think, okay. I'm sorry about that. I was getting some background noise. Anyhow, the oils also can help remove and eliminate some of the biofilm. Slime, it's a slime layer that will cover the germs that germs develop. And so it can help with that as well too. So that's probably where I would start these days. The crypto, a dose for Borrelia that I like to work up to is half a teaspoon 3 times a day. When I'm using to treat Babesia, if you read some of my stuff, you'll see I do a teaspoon 3 times a day. But for Borrelia, and when I use it for Bartonella, it's a half teaspoon 3 times a day. And then the cinnamon, clove, oregano, I would do a capsule twice a day on that. And then the glutathione, I was telling you about the Trifortify product, as well as that curcumin, those are going to limit your Herxheimer reactions too. So as you start killing these infections, sometimes we trigger something called a Herx, which is the immune system sees the dead bug parts and you make more cytokines, so you get worse. But by being on those 2 things, that's going to help with that as well too. Okay. And I don't know if you're familiar, but I have a whole protocol for treating tick-borne infections. Are you familiar with my Ross support protocol at all?
No, not yet.
Let me show you. I'll just show you because it's a good start. It's a good place to look. Okay. Let me just do a screen share here. All right. So this is back at This is my education site, Treat Lyme by Marty Ross MD. Okay. And it's at treatlyme.net. If you just click on this tab here called the Ross Protocol. Oops, it looks like I got this set up weird. Hold on here a minute. Here again, try that again. Anyhow, this is what it looks like. And then literally it gives you the key steps you need to take to get over this illness. So it's not just enough to click on this little Lyme infection section here that tells you how to kill it. You also need to make sure you're doing things to support your immune system, like get sleep, have a healthy diet, make sure you're protecting your intestinal microbiome. Anyhow, I walk through the key steps that you ought to consider as part of a treatment here. Okay. So with tick-borne infections, it's not just enough to kill your germs, unfortunately. All right.
Fantastic. And is there any variation with an IgM versus IgG?
No, for practical purposes, no.
Okay.
Yeah.
Thank you very much.
All right. Good luck to you. All right, let's see here. Does anyone have follow-up questions to what Kelly was asking there? All right, let's move on. Hello, David. Let's see. I have Pectosol and Glypho Detox. Will they be helpful as binders for my mold toxin? So, yeah, Pectosol is pectin, and pectin I consider to be a general multi-purpose, goes after a number of toxins. And I like it because compared to other binder products, it tends to be not constipating. Okay. So yes, you can do that. Glypho Detox, I'm not familiar with the product. Let me look that up here real quick. I'm going to do a screen share. We'll look it up together here. All right, so it's got pectin, algamate, kelp, and fulvic acid. So that the main thing I see here, so it's more pectin, okay, but it also throws in some fulvic acid. That fulvic acid, I always have to look at my table. It's not a broad binder, but if you've got a lot of toxins, just being on the pectin, either directly in this product or as a direct supplement, I think will do the job for you. Did that answer your question for you? All right, let's move on here. So hi, Cindy. Cindy says, I have the 3Bs and mold toxin illness. Right now, I'm not taking meds or herbals. About yeast problem, I scored 291 on the questionnaire. That's a high score. Yeah, as you know, my 140 is what my cutoff is to get
I know.
That's a high score. All right. And then do you advise any changes to your weed, feed, and seed protocol since I'm not fighting the illness right now? Been taking Megaspore, oregano capsules, and a phospholipid profile powder blend. All right. So, the weed, feed, and seed is basically for intestinal yeast overgrowth. You got to lower your germ load. That's the weed part. Okay. So you got to kill them. All right.
Yeah.
The feed is you want to feed your good bacteria. And you can do that with diet or you can do that with supplements. With diet, a plant forward diet, I didn't say plant exclusive, I said plant forward, right?
Yeah.
Is going to give you a lot of prebiotic fibers. And also, if you have a good mix of colors in there, you're getting a lot of polyphenols. So, polyphenols and your prebiotic fibers from a plant forward diet will feed the healthy bacteria. All right. Now, if you are not, especially with that kind of score, 291, you need to do something to support your healthy bacteria. If you are not having that kind of a diet, then you might want to look at taking a polyphenol and also taking a prebiotic. Okay, so for instance, at my store, Mega Pre is a prebiotic that I carry, and there is a product called Polyphenol Booster by Pendulum. Both of those I would do 2 pills 1 time a day. Okay, and you can find those at Marty Ross MD supplements. You know where my store is, but you could get those. Okay, so if you could do it through your diet, great. If not, but you just need to make sure, especially with that kind of score, that you are feeding your good bacteria to outcompete the yeast. Okay, and then in terms of a seeding, that means being on a good probiotic, and you might. What are you doing? Oh, you're doing the Megaspore. Megaspore is fine. You could do with that. So your Megaspore is a good probiotic. Your oregano caps are your antifungal that's going after intestinal yeast. You'll have to see if that's enough by itself. Sometimes I find herbally single ingredient herbs don't tend to work as well as multi-ingredient anti-candida herbs, right? So for instance, the Capri Plus that I've mentioned before by Karuna has caprylic acid in it, oregano, and garlic, right? So there's 3 things in there that are killing, basically. Okay.
Okay.
All right.
Yeah.
Yeah. So yeah, I mean, yeah, you can get at this on your own, but I would probably, especially that scar, I'd be a lot more aggressive at supporting your healthy bacteria that are there by feeding them. Okay.
Yes. Thank you very much. Thank you.
You're welcome. Good luck to you.
Thanks.
Yeah. All right. Let's see, Chris, I see your hand up there.
How long would you seed and feed before you start weeding then?
Oh, you can do it all at the same time.
Oh, okay.
Yeah.
Perfect. Thanks.
You're welcome. So for those of you that aren't familiar, I have a pretty detailed article about this whole concept too. It's a little long, but it does give you the information. And let me find it here for you. So what I've done here, I made it so I can't see anyone now. All right, let's see. All of our pictures were blocking my ability to see my screen here. All right, so if we go, I think we'll do, I'm just going to go look in my online guide, look under yeast, and then take a look at, you could either look at my kills and prevents yeast a brief guide, or I should have this is the monster article here. Okay, it's called Your Guide to a Healthy Intestinal Microbiome. I get into a lot of detail about how you support and what works best. Okay, so this just gives you a little bit more of a comprehensive look at it. All right, let's see here. Hello, Grace. Let's see. I've had intermittent gut issues, constipation, and SIBO for nearly 10 years. Now it's pretty much constant pain, distension, the splenic fracture, and sigmoid, and descending colon, very slow motility. Vibrant Lyme test showed positive for Borrelia burgdorferi and moderate for Bartonella elizabethii, in addition to Candida and mycotoxins. Should I treat for the 3Bs first or address dysbiosis gut issues using a different treatment approach first? My daddy doesn't tolerate doxycycline co, so I'll alternative for Lyme treatment. I've been taking oregano off and on for years, which has always helped with the gut, but now doesn't seem to be effective. Vibrant Labs, July 2024, elevated cadmium, aflatoxin, some other toxins, beta-glucuronidase, TGF-beta, and you've had a CT, ultrasound, MRI, or normal. Also have POTS, stiff person syndrome. Okay, so one thing I can tell you right now, when I look at the labs you shared with me, if you have elevated beta-glucuronidase, that means your intestines are loaded with unhealthy bacteria. I can just tell you by looking at that, okay? The constipation you're having could be part of SIBO. There's a type of small intestine bacteria overgrowth situation where the bacteria that are growing too much in your intestines, in addition to fermenting food and giving you a lot of gassiness, one of the gases that they might produce themselves is methane. And if your SIBO is a methane variety, methane producing variety, that methane constipates you. And when you get constipated, it's hard to detox, right? In a situation like this, where there is a lot of gut stuff going on, I like to address the gut first, because if you start going after the tick-borne infections, you're going to disrupt the healthy. We already have a disrupted microbiome. I can tell by that beta-glucuronidase in your symptoms. You're likely to make it a lot worse. I think you need to clean up your gut first. That's where I usually start in people with this situation. And you might want to consider figuring out what type of SIBO you have by getting a SIBO breath test. In a SIBO breath test, basically you swallow sugar water, mannose, I believe, and then they collect. You have these little tubes that you breathe air into, or you breathe into, not air, you breathe into over the course of 2 hours. If you have constipation, we tend to like to do it for 3 hours, and we're measuring what happens with hydrogen and with methane. And if you're a high methane producer, it makes your SIBO a lot more difficult to take care of. There is, if you do have SIBO, one thing you could consider trying, which would be something that would also start dealing with some of your tick-borne infections at the same time. That is a product called Biocidin it's called Biocidin. It's got, I think, about 13 different herbs in it, but the herbs can kill Borrelia and Bartonella, and it's a great mix for going after SIBO as well too. So it's one way of doing them all at the same time. Okay. So Grace, did that answer your question for you?
Yes, it did. I have just a quick follow-up question to that. I've done Biocidin in the past. It's been quite a while ago since I've done it, and I can't recall if that product has tea tree oil in it or not, but I'm allergic to tea tree oil. There was some product that they have that I couldn't take because of that.
Yeah.
And then also wanted to ask you, I've done the SIBO test before, but it's been a while back, and I actually didn't have a whole lot of methane. I was more of the hydrogen.
Yeah.
And even though I have a lot of gas trapped there, it's not like the typical methane SIBO symptoms, where it's a smelly gas or anything like that. And so I don't know what's going on with that. But I also wanted to ask you, you've mentioned about cytokine release and taking things like curcumin or quercetin to help with cytokines. But I also have low white blood count, and I didn't know if any of that would lower that further.
No, I don't think that's going to lower it further.
Okay. So you're saying to start out with a SIBO breath test and then treat SIBO if that's what I have, or other dysbiosis.
Yeah, there's two things I would do with that gut symptoms you're having. It's possible it's intestinal yeast overgrowth. It is also possible SIBO, but especially since you've had a history of SIBO, I would go looking for that. And if the SIBO comes back negative, you might want to consider treating for intestinal yeast overgrowth as well. Testing is not great for intestinal yeast overgrowth. If we were to measure yeast in your stool, it might say you have yeast, but we all have yeast in our stool. What's the issue is it relatively too much to you? And we don't have a test that says what's relatively too much for you. Okay. Likewise, I have seen people with tons of intestinal yeast symptoms before that have no yeast that come out in their stool. And yet when we treat for intestinal yeast, they get better. So yeah, you might want to look at regarding intestinal yeast, take a look at my article. It's called, or you may have seen earlier, go to that yeast chapter that I have in the online Lyme guide. You'll see there, the first article there is my article about how do you diagnose intestinal yeast. So I would consider that as well too.
And I don't have a lot of the typical yeast overgrowth symptoms except for gut.
Yeah.
It doesn't really seem to manifest anywhere else.
You could even have something called CFO, which is small
Right.
intestine fungal overgrowth too. But yeah.
Okay. Thank you.
Good luck to you. All right, everyone. Let's see. I think I'm going to call it for tonight. So we're about 7:30 here. So again, I'll do my best to try to get the recording handled tonight, but if not, then you may not get it from me until I may not post it until middle of the afternoon tomorrow. Okay. And then I'll be off next week because I'm giving a talk in the middle of Ohio, and then I will back here again with you in 2 weeks. We'll do it all over again. Okay. All right. Been good being here with everyone. Take care.